Hello everyone, welcome back to my channel. This is Dr. Precious, and today we're going to talk about how to take care of yourself after you get your teeth pulled or you get your teeth extracted. Whether it's one tooth, two teeth, or all your teeth, is still the same thing. And if you do everything I'm going to tell you, you will heal in no time, because patients experience delayed healing, incomplete healing, or sometimes they get something called dry socket. Dry socket is when your body doesn't heal and you literally have bone exposed in your mouth. Somebody will look into your mouth and see white bone, and it hurts, trust me. And another thing is to prevent infection and so many other things. So this is what you need to do after you get your teeth pulled. The first thing that you have to do, if you don't remember anything else, remember this, is to leave it alone. Because I have patients that are picking on it. They will come and say, oh, I saw this, I saw that. Is this okay? Is this normal? They keep asking these questions because they keep picking at that area. They keep trying to look at it, looking in the mirror, holding their mouth open with a mirror, trying everything to poke at it. Resist every urge to touch it. Leave it alone and let it heal. Let your body do what it's supposed to do. Number two, after you got your teeth extracted, you're going to be numb for some time because your doctor probably gave you some injections to deaden that area. You will not feel pain during the procedure. But when you're going home, that area will still be numb. So you're not going to feel anything. So by the time you get home, it's going to take roughly 2 hours for it to wear off. For some people longer, depending on the amount that was given to you. For some people shorter. Before it completely wears off, take your pain medication. If you don't take your pain medication before your anesthesia completely wears off, you're going to be in serious pain. You're going to be in so much pain that you will think something is wrong. So take that medication so that the transition won't be as bad. And take the medication as your doctor prescribed. Don't start experimenting with drugs or taking more because you feel the pain is too much. If it's not taking care of the pain, you may call your doctor and let them know so they may be prescribe something stronger if it's truly not taking care of the pain. If you were giving antibiotic, make sure you finish the antibiotic. The pain medication, stop taking it once you don't have pain anymore. But the antibiotic, finish it because there's a reason it was given to you. And then before that anesthesia wears off, don't put anything in your mouth because you may mistakenly hurt yourself because you're not going to feel it. So that's the medication. What is the third thing you have to do? Remember, if you start eating, don't use a straw to drink anything. Why? Because you don't want to use that suction motion and disturb that area. Remember, we want to leave it alone as long as possible. So don't drink through a straw, anything crunchy. Don't eat anything that would potentially disturb that area. Don't eat anything hot, and don't eat anything with grains. Eat soft things, maybe yogurt, mashed potatoes, things that are soft and you can easily swallow without having them lodge in that area. The thing is, if you get food in that hole, your body is not going to walk around food. Eat soft things till it at least closes up. What are the things you can do to help your body along? You can use ice pack on the outside of your cheek, especially if you have swelling. You can use tea. Tea has an ingredient that can suit that area. So you can literally just put it in your mouth and bite on it. So now when you're leaving the dentist's office, it's important that you continue to put pressure on that area. They're going to usually give you something called gauze that will go on that side and they will ask you to bite. The reason for that is for you to put pressure in that area. The same concept with the body. When you have a wound, if you apply pressure, it will stop bleeding. So you apply pressure in that area so it will stop bleeding. It might be different for every doctor or every dentist, but I'm going to give you a general idea. Usually you will feel a little bit of blood mixed with saliva in your mouth in the first maybe 2 days. So if you see it, you can change the gauze and you continue to put pressure. If you start seeing a lot of blood, you'll see more blood than saliva, literally just bleeding nonstop. call your doctor because something may be wrong. But if it's just light bleeding, you see blood mixed up with saliva here and there, you can just change the gauze and gently get rid of it. Don't spit because the spitting motion can also disturb that area. Everything you're doing, you want to gently glide it along. Even in 2 days, you can start rinsing your mouth with salt water. We recommend maybe half teaspoon of salt in 8 glass of water. Mix it and use it to rinse your mouth. And when you rinse, still don't do a forceful spitting motion. Just kind of open your mouth and let it fall off, and do your best to not disturb that area. Should you brush your teeth? Yes, you can brush your teeth, but when you start brushing your teeth, brush the rest of your mouth and brush gently. So again, you don't disturb that area. And while you are doing all this, make sure you're resting. I do understand the temptation to jump back out and go start running. You need to give your body time because this is surgery. Something was done to your body. The ecosystem was disrupted somehow. So you need to give it time to heal. Your body is going to work extra hard. It's going to send cells in that site. It's going to send things in that site to try to get you whole again. So relax and give your body time to work. So don't go back jogging. You can take a little time off, maybe a day or two, and then you can decrease your activity again, maybe a day or two. So your body will have time to heal. And then listen to your body. If you're feeling better, then you do more. Don't do past yourself. Relax and let your body heal. Everyone is tailored differently. Some people take longer to heal, some people heal immediately. Another thing is, if you're still smoking, bro, sis, what are you doing? What are you doing? But anyway, you don't know how many times you tell people this and they don't listen and they come back because they're not healing as they should or because something happened and you have to start all over. So if you smoke, stop smoking for at least 72 hours. If you drink, stop drinking alcohol for at least 72 hours. We prefer you stop smoking completely, but if that is an impossible thing to do, at least cut down. But for 72 hours, no smoking at all, non negotiable. Depending on your particular situation, most dentists, like me particularly, I nearly suture 90% of my extractions. I put suture in there, I put bone in there because I have come to find out that it heals much better. It heals much nicer. The ridge is good, is preserved, especially if that teeth is going to get replaced. It gives you enough bone that when that time comes, you have enough to work with, whether it's partial, whether it's implant, whatever it is. And it heals very beautifully. I basically have zero complications post-op wise since I started using bone and sutures. If sutures were placed after your extraction and if bone is placed, the kind that I use anyway, you may see little particles. Don't be alarmed. It may just be little specks of the bone. It's okay. And if that suture should be dissolving in 7 to 10 days. So don't start picking at it and start wondering what is this. So you may feel it with your tongue. Again, leave it alone. It's going to dissolve. It's there to help your body heal very well and heal very nicely. Another thing is, when should you be calling your doctor or your dentist? If you see any sign of infection, like swelling, pulsy, foul odor, intense pain that is not going away even with medication, fever, if you see any of these, you should be calling your doctor right away because it could be an infection. But if not, it's okay. Everything is going to heal well. And if you look at it and you see maybe a white scab there, don't be alarmed. That's the way it heals. It's not something bad. Eventually, it's going to be okay. It's going to heal completely because some people sometimes mistake that for a pus or mistake that for infection or for something bad. It's not. But when in doubt, you can call your dentist and make sure everything is okay. If you do everything that you're told to do by your dentist, you usually will be okay as long as you're a healthy individual. So, in another video, we're going to talk about people with diabetes, people with issues, and a whole lot of other things. We have a lot of other videos coming up on dentistry, so stay with us if you can. If you gain something from this video, don't forget to like and share it with a friend. And until next time, thank you for watching, and may God bless you. Bye.